Hey guys, welcome to Painless Conversations. My name is Emil Kurian, and this is my one and only brother, Christopher Kurian. And Chris, this has been honestly like a long time coming, right?
Yeah.
We've thought about this probably since like the end of medical school, start of residency, sort of a moment or a space to kind of reflect on the journey, right? Because as we all know, the days go quick, but the years go even quicker. So just Painless Conversations, we want to make it sort of a reflection point to talk about our journey, the ups, the downs, all the stories in between, and most importantly, how brotherhood was kind of tied into all of that.
Yeah.
So without kind of further ado, I'd like to kind of give a formal introduction to my brother. So Christopher Kurian, self-proclaimed Gen Z, actual millennial. He is the fashionista, TJ Maxxinista of the family. Yeah, we're really going to go there, bro.
We're going there.
But on the real, huge sports head, really into basketball, all-star point guard, all-star quarterback. I always talk about, growing up, especially as we got into like middle school and high school, it wasn't a older brother, younger brother dynamic. It was very much we were one team. And we build on each other's weaknesses and our strengths. Yeah. And I think we kind of complete each other in that way. So I think throughout this whole journey, whether it was medical school or residency, we were able to kind of capitalize on that. And I think this is kind of where everything comes together, right? And we're able to talk, we're able to reflect. And I think we're going to learn a lot about each other through this experience too.
Yeah.
So, yeah.
If I can introduce my brother, this is Emil Kurian, my only and best brother. Let's see. What is there to say? This guy is a jack of all trades. He is a family man, first and foremost, car aficionado, my best friend. Actually, I have to give him a lot of credit because whenever I was applying for interviews, whether it's like college interviews, med school, residency, they would always ask who your inspiration was. And I'm just going to be candid here because I'm here with Emil. So I would always use Emil as basically my hero. He has been the guy who gave me the passion to go into medicine, gives me the passion every day to persevere in medicine, and he's just such a role model to me. So I'm just blessed to even be sitting here, to be honest, sitting here with you and, to be brothers in the same field of anesthesiology and be so close in age, have very similar but also very different experiences up to this point. It's just a blessing to be here with you, man. So I'm excited.
It's going to be good.
Yeah.
I'm excited. That was really nice. I don't think I've ever heard that kind of reflection from you.
It's going to come in hot.
Okay, I like it. So, and like we were saying, so Chris, I think I might have told you this a little earlier, but didn't really share the full details, So Ashley and I were sitting down just at dinner one day, and, I was just like telling her, like, 30 years from now, right, we're going to reflect on this time, like the hustle and the time crunch of residency and just like being in your mid-20s or late 20s. Yeah. And we're going to think back like this was one of the most amazing times of our lives, right? So much going on, friends, family. And with that in mind, how awesome would it be to just, again, slow things down and reflect on that? So that was like a huge part of Painless Conversations to me, a reason for really doing it, being able to do it with you.
I think coming off of that, even, back in the day when Dad, like when we were really, really small, when we had like VCRs and video recorders, like Dad would be taking video recordings of us like at like 1, 2, 3 years old. And he'd always have these like awkward entrances like, hey, what's your name? What's your name? To his own kids. And like,
where are you?
Yeah.
What's the date? What's the weather? What's the humidity?
Yep. He would ask us to record him just to make sure that he was
included in the family video. Yeah, exactly.
But, as weird as it kind of felt at the time, now looking back at that and seeing those videos, you just realize like how special it was for Dad to even think about doing that, for us to like remember our childhood, document it. Yeah. And they're like, those memories are like now cemented in my brain, which is also why I like really want to do this with you too, is because I still have a lot of those fond memories from back then. A lot of it stemmed from Dad. So I got to also give a big shout out to Dad too for kind of being that fire that has like sparked subconsciously a lot of this, documenting and podcasting interests.
100%. I mean, like, you think about like one of the first India trips we made, and we went to visit the Taj Mahal. Of course, it's like 110 degrees outside. At that age, my mother dressed us very similarly. We're in these like thick polos and jean shorts, and
They're always extra large.
they're always extra large.
We got to make sure that we grow into our clothes, right?
Exactly. The shorts got to be at least mid calf. Otherwise, they're not stylish. 2000s. Let's go.
I don't think we've still grown into those t-shirts.
Probably not. It's really interesting actually because I think mom really genuinely thought I was going to grow into triple XL shirt in like 5th, 6th grade, but sorry, mom, that never really happened. So to kind of get into the meat of the discussion then, Chris, we wanted to take some time to talk about code blues. We'll start with kind of just what a code blue is. So, the first time you experience a code blue in the hospital, it's sort of a rite of passage for everyone in healthcare, right?
Yeah.
It's starts as just kind of being in the corner of the room, not knowing what to do, to leading, orchestrating, being a pivotal role of that team. So I think just for everyone, just to start with like what a code blue experience, what a code blue even is.
Right.
So a code blue is simply when your heart and lungs stop working, and you go into cardiac arrest or respiratory failure, where a few things are happening. There's no perfusion or there's no blood flow to vital organs like the brain, the heart, kidneys, so forth. And there's no oxygenation if the lungs aren't working to also those vital organs. So this can happen. And as anesthesiologists, we see this time to time in the operating room.
All the time.
Right? Sometimes we see it in the intensive care unit, the ICU. Sometimes we just see it in the hospital on just regular medical floors, and sometimes it's not even patients that experience these things. So there's a big role for CPR. And the code blue response is, in essence, a team of healthcare providers, nurses, doctors, pharmacists, respiratory therapists, that come together to help manage the situation and figure out the steps to help resuscitate this person. So with that in mind, maybe, Chris, you want to take a jab at your first code blue and how that went?
Yeah, I'll take a jab at it. So everyone's first experience on code blue, it's just something you never forget. So let me just set the scene for you guys. So just imagine it's your first day of going into the emergency room as a medical student. You're probably have your white coat on. Mom probably dry cleaned it. It's nice and clean. So I'm expecting a relatively quiet day in the ER, whatever that's supposed to look like. It's never usually quiet. But first thing in the morning, my attending tells me, hey, go over to the trauma bay. We have someone coming in by ambulance for a motor vehicle accident. And so I was like, okay, this is interesting. I've never been to the trauma bay before. I'll probably just watch and see, what's happening. And shortly thereafter, this lady gets wheeled in with a stretcher from the ambulance into the trauma bay. They placed her onto the bed, and immediately one of the fellows or attendings assessed the patient, noticed that they don't have a pulse and they're not breathing. So immediately they call for a code blue, and we conduct CPR. And so me being the med student, it's always a rite of passage to allow the med student to get the first crack at doing chest compressions. I've never done chest compressions on a patient, but I went to the front head of the bed, not the head of the bed, but the side of the bed, and I started doing chest compressions just as I learned in med school. And man, I can't even tell you the mixed emotions and
it's not as glamorous
that you get.
It's not as glamorous as they show in like movies and TV shows, right?
Exactly. It's organized chaos.
Yeah,
is
definitely
how I'd explain it.
Yeah,
lots of things moving around, but I just remember that I was pushing on this lady's chest, and man, you are focused in the moment, but you're also stressed. You feel the coldness of that person's body right underneath you. And I just remember that each one of those chest compressions felt like a minute, and chest compressions are really hard too. So you're really feeling each compression, and it's such a almost a spiritual moment, because I felt not only that, are you trying to save this patient, but you realize that this patient has a story, they have a background, they have a family, friends, and to understand that you're dealing with someone's life in your hands, like physically in your hands, was really intense. And I just remember as I was doing chest compressions, The patient started having hemoptysis or blood
Coming out of their mouth, right?
Coming out of their mouth.
Yeah.
From not sure exactly where, and they had to be intubated. And I just remember that even with all these chest compressions happening, I had a deep pit in my stomach thinking that this patient's not going to make it. And so the craziest part, I would say, out of all of this, though, was patient unfortunately did not survive. We, everyone kind of starts to disperse, and I come up to my attending, especially as a med student, these things have a big emotional toll on you. So come up to my attending, kind of see, what the next steps are. And they say, hey, we have a patient in room 4. Why don't you go check them out? And I immediately kind of double take a little bit because I was like, man, this is how things are, I guess. This is, you don't really always have a time to reflect or even catch a breath, especially in the emergency room. So I feel like there are a lot of untold stories in that atmosphere, and as well as a lot of untold emotions and memories and stress that people kind of hold on to just because you kind of need to have that mentality to survive in a place like that. I don't know, Emil, if that's how you felt in your first experience.
So, thanks for sharing that. I feel like that is sometimes the toughest part, like the regrouping and reflecting on that moment. I feel like in residency when we've had code blues, there is a team that they get together, they reflect on the pros, the cons, what went well, what could we improve on, and even I know you didn't have that when you had your experience, but I can say that when you have that experience, you talk about the objective things that went well. We called the code quickly. The teams arrived. Good leadership, good person with the recording and the timing and all that. But sometimes we don't talk about just how you're feeling in the moment.
Yeah.
Right? And even if you have that objective discussion afterwards, you walk away still feeling like that was a person, that was a mom, a dad, a friend, an uncle, a sister, whoever, that's gone. So yeah, my first experience in a code blue situation was when I was a medical student. I was in kind of my 4th year of medical school, the last year of medical school. I was in the surgical ICU. So these are patients that are coming back after surgery, after usually a major surgery, or there's a complication surgery and they need to be monitored more closely, right? And so this patient, they found some fluid in their lungs, or a pleural effusion. And one of the team members, I believe my fellow at the time, wanted to drain the fluid from the lungs. So they, set up to do the procedure, but the procedure didn't go as planned. And I believe they accidentally hit the lung instead of being able to drain the fluid. So the patient's oxygen number started to desaturate. The oxygen number started to go down. And, many nurses rush in, the attending physician rushes in. I'm a medical student. I'm kind of like you in the corner of the room, kind of watching what's all unfolding, this organized chaos, like you said. And someone yells out, "There's no pulse." So they flatten the patient. They take the head of the bed away. One of the charge nurse starts compressions for the patient. They call the rest of the rapid response team. So like I was saying, that can consist of a lot of different team members, but sometimes anesthesia shows up to help with putting a breathing tube in, a pharmacist to have medications for emergency available. And, so I also too was a medical student in the line of chest compressions. And in the moment, I was just so focused on the compressions.
Yeah.
And it's like you want to, and the thing with compressions is like you want to push hard, but you shouldn't lean into the patient, right? Because you need recoil and time for the chest to come up, and you can actually give good quality compressions. Yeah. So I was just so focused, and I remember like sweat dripping down my face. Oh, and to add, this was during COVID, right?
Oh,
so
man.
we're all in gowns and N95s, and I'm just sweating through my scrubs at that point. And, this is going on. Obviously, bigger things are going on with the airway up top, and they're starting medications, epinephrine, all of these different things. And I see that the door is wide open to the patient's room, and standing outside is this person's wife and 2 sons.
Oh, wow.
Yeah. So, at the time, I didn't know this was kind of part of the culture, but like having the family be able to from a little bit of a distance see what's kind of unfolding. I know in my mind what raced through was, man, what a tough sight to see. I immediately thought of like, of my dad, if I was in this situation, watching someone give him chest compressions, how tough that must be.
Yeah. I mean, what would you, in a scenario like that, would you want someone to direct you out of that scene, or would you feel like, and it's different because you're a medical provider, right? So you kind of have an idea of what's going on.
Yeah, and that's a good point, right? So, and just to finish kind of the story, so he unfortunately didn't make it, and a little later we actually did have a kind of reflection roundtable kind of discussion, and at a later point there was a discussion with the family, so the wife and the 2 kids, and they were so grateful for the care he did receive, and they were obviously saddened by the death of their father, but at the same time, sense of relief to see the great care he was receiving the whole time. So that kind of shifted my perspective a little bit, right? So going back to your question, would I want to see my dad or family member getting compressions done? I think now seeing them, personally, I don't know if I'd want to.
Yeah.
Personally, not. And maybe that's because we've been in these situations, we've done the compressions, we've pushed the epi, we've put the breathing tube in, and it can be messy. And it's just different when it's your own family member, right?
I was just gonna say, I think it's beautiful to hear that family still had so much trust in the medical community. I mean, it sounds like there might have been a complication with draining that fluid, which could or could not have led to the patient arresting. But even with all those things, I just find it so nice that the family still put their trust in you guys, and we're thankful and grateful for the care that you guys did provide, because these things do happen in the hospital, unfortunately, right?
Yeah.
Errors, just a part of everything that we do in this world. So, and it's not often that, families may react that way.
Yeah.
So,
yeah, I think it's as tough of a situation that was in that moment, and just kind of feeling down and moving on to the next patient. That those few words or few sentences the wife shared about the care team and how happy was for the good care that her husband did receive really was uplifting.
Yeah.
That was kind of just brought everything together as what we're doing is important, and we need to keep going to the next level and provide the same quality of care that we always do.
Yeah.
So in one way, you get one thing out of that, and you hope to improve and you learn from those situations to help patients in the future. So that's very interesting.
I was also just going to say, in terms of learning for the future and taking feedback and improving from those things, kind of something that you said before that I just wanted to touch on was, you said that you guys were able to kind of come back together at the end of your code and talk about these things. And I would say one of the best codes that I've ever seen ran was someone very near and dear to my heart during residency. And it was a trauma patient that came into the operating room, and they all have already coded, and the patient unfortunately didn't make it. But I just remember right after that scenario in the operating room with everyone standing there, the leader of the code had a moment of silence for the patient where everyone put their head down, kind of explained that, for us, maybe it's just another day in the operating room, but for this patient, their friends, family, it's a really sucky day. And it's someone who had dreams, aspirations, maybe a family.
Yeah.
It's a real person. And so after that, it just really kind of put a weight oh, wow, this is actually a moment. It's not just a fleeting moment, but this is a moment in time.
Yeah.
Which we should care about and consider.
Yeah. And
then afterward, he took all the main kind of players who were running the code, and we all sat together in his room with a cup of coffee, and we all kind of went around in a circle and talked about what things that went well, things that didn't go well, and any emotions that just needed to be let out, whether that's sadness or feelings of feeling proud that we worked together as a team, even though it wasn't the outcome we wanted. And that brought so much relief and just like a sense of closing a chapter,
Yeah.
which I really appreciated and I think everyone needs. And it doesn't even have to be medical codes. It can be any scenario in the hospital, right? Just being able to acknowledge that the like mental health really does matter in the hospital, and you don't need to act tough, quote unquote, anymore.
Right.
That we should be
You
able
don't have to carry
feel
this burden by
open
yourself.
and vulnerable,
Exactly.
and
You should
having
be-
painless conversations
and
about
having
it, right?
exactly having painless conversations.
Yeah.
I think, we want to be able to care for our patients. We want to be able to do the best, but sometimes, like you said, those are the situation or the outcomes are not what we expect or what we want. But it's important to protect yourself in the setting, and specifically your mental health, your physical health, because in order for you to continue and carry on caring for patients, you have to care for yourself. So that's a really important piece, right? I think we're all humans. We all have our needs, and I think it's so important that after stressful experiences like that, it might not even be a code situation.
Yeah,
It might have just been a hard day in the ICU or a hard day in the OR, just a hard day at work. And whether it's a family member, a best friend, a coworker, talk, reflect, just don't bottle it in there, because it will build up and it's stressful. What they do, what we do all do in healthcare is a lot. So, yeah,
No,
I think that was pretty nice. I think I'm glad I'd never heard that story that you had mentioned about like when you're in a residency and they reflected about the code experiences. That was really nice, actually. So, anyway, I think to kind of wrap things up and reflect on what we kind of talked about. So the first thing, obviously, like I just mentioned, mental health, physical health after these situations is super important. So take care of yourself.
absolutely.
And then everyone should know CPR. Like CPR.
It's funny, but also it's very, very true.
Let me take a step back.
Yeah.
The technical term is BLS, or basic life support,
Yeah.
which is knowing how to check a pulse, where to check a pulse. And we're not going to get into the depth of that. There's way better resources out there that can provide details. But, this isn't happening in an OR. This isn't always happening in ICU. This could happen at the kitchen table when someone chokes on a piece of food and, or someone has a heart attack. And I remember this was when we were a lot younger, but there was this wedding we went to. We were probably in middle school, and I don't know what happened, but this was like outside of the reception area, and I think someone had a heart attack. But someone went in there, and I remember them finding a pulse, and they were about to start compressions and stuff. But then it was like, oh, no, I guess someone was healthcare medically trained. Like, no, he has a pulse, he's breathing, he's fine. But the fact that someone was ready to do that is pretty cool. So. Everyone should know that. It could affect loved ones. You never know.
Absolutely. Acting fast, but also getting help.
Getting help.
You can't do any of this stuff by yourself.
Yeah.
You can't you can't do CPR by yourself.
No.
You need to call for help. Act fast, but call for help. Get hands, and also just being able to allocate resources.
Yeah.
Whether you're the lead or you don't feel comfortable and you need someone else to take the lead.
Yeah.
Feeling comfortable in what you're doing and making sure everyone's comfortable in their role is also super important. So anyway, I mean, that can really change someone's life.
Yeah. Yeah.
So not something to take lightly, but yeah, if you have questions about CPR or just still need to kind of brush up on the basics of it, so many resources, and you should. Definitely should.
Chris didn't get these guns because he's only done CPR a few times. He's done it many times. That's how he's get the biceps working. But maybe now's a good time to wrap up, Chris. We can talk about, thank you for joining us. We're really excited, like we said, to start this kind of journey. Chris and I, and of course with you.
Yep.
Let us know about your maybe first Code Blue experience, or your reflections, things you've learned, things you'd want to share for other people to know. And then let us know about any general topics you want us to talk about. We're open ears, and we would love to hear from you.
Yeah, this isn't just a journey for Emil and I. It's a journey with you guys as well. So we definitely want to hear from you, and thank you guys all for tuning in to our first episode. Again, could not have done any of this without you guys, and it really is all for you guys as well. So we really appreciate everything that you do.
We'll see you guys next time on Painless Conversations. Take care.